Welcome to M Health and Info, your ultimate source for all things health and wellness. Join us as we explore the latest in medical science, debunk health myths, and provide expert insights to empower you on your health and wellness journey. Hit subscribe, ring the bell, and let's explore the world of well-being together. This is M Health and Info, where knowledge meets vitality.
These 12 tips are important to do or practice for controlling asthma during the rainy season. 1. Monitor weather forecasts. During the rainy season, staying informed about weather forecasts is crucial for individuals with asthma. Rainy weather can exacerbate asthma symptoms due to increased humidity and the presence of airborne allergens. Weather forecasts can help individuals anticipate days with high humidity, heavy rainfall, or sudden temperature changes, which are common triggers for asthma symptoms. Humidity levels play a significant role in asthma management, as high humidity can make it difficult to breathe and exacerbate respiratory symptoms. During the rainy season, humidity levels tend to rise, especially during periods of heavy rainfall. High humidity can cause moisture to accumulate in the airways, making it harder for individuals with asthma to breathe comfortably. Additionally, high humidity can promote the growth of mold and mildew, which are common allergens that can trigger asthma symptoms. 2. Stay indoors during heavy rainfall. During the rainy season, individuals with asthma are advised to stay indoors during periods of heavy rainfall to minimize exposure to potential asthma triggers. Heavy rainfall can exacerbate asthma symptoms by increasing humidity levels and stirring up allergens in the air, making it difficult for individuals with asthma to breathe comfortably. One of the primary concerns during heavy rainfall is the increase in humidity levels. High humidity can make the air feel heavy and dense, making it harder for individuals with asthma to breathe. The moisture in the air can also trigger asthma symptoms by causing the airways to become swollen and inflamed. For individuals with asthma, high humidity can exacerbate respiratory symptoms such as wheezing, coughing, and chest tightness. In addition to high humidity, heavy rainfall can also stir up outdoor allergens such as pollen, mold spores, and dust mites. Rainfall can cause these allergens to become airborne, increasing the risk of exposure for individuals with asthma. Inhalation of these allergens can trigger asthma symptoms and exacerbate respiratory distress. To minimize exposure to asthma triggers during heavy rainfall, individuals with asthma are advised to stay indoors whenever possible. Indoors, individuals can control their environment by using air conditioning or dehumidifiers to maintain comfortable humidity levels. Keeping windows and doors closed during heavy rainfall can also help prevent outdoor allergens from entering indoor spaces and triggering asthma symptoms. 3. Keep indoor spaces clean and dry. Maintaining clean and dry indoor spaces is essential for individuals with asthma, especially during the rainy season when humidity levels may increase and mold growth may become more prevalent. Dust mites, mold, and other indoor allergens can exacerbate asthma symptoms and trigger respiratory distress. Therefore, regular cleaning and moisture control are crucial steps in asthma management. During the rainy season, indoor spaces can become more susceptible to mold growth due to increased humidity levels and moisture accumulation. Mold thrives in damp environments and can grow on surfaces such as walls, ceilings, carpets, and upholstery. Exposure to mold spores can trigger allergic reactions and exacerbate asthma symptoms in sensitive individuals. To prevent mold growth, it's essential to keep indoor spaces clean and dry. Regular cleaning of indoor surfaces and furnishings can help remove dust, mold spores, and other allergens that may exacerbate asthma symptoms. Use a vacuum cleaner equipped with a high-efficiency particulate air (HEPA) filter to effectively capture dust mites and allergens from carpets, rugs, and upholstery. Dusting surfaces with a damp cloth can also help trap dust and prevent it from becoming airborne. 4. Use air conditioning. Using air conditioning during the rainy season can help individuals with asthma maintain a comfortable indoor environment and reduce exposure to outdoor allergens and pollutants. Air conditioning units help filter out airborne allergens, such as pollen, mold spores, and dust mites, and maintain optimal humidity levels indoors. During the rainy season, humidity levels tend to rise, creating favorable conditions for mold growth and exacerbating asthma symptoms. Air conditioning units help control indoor humidity levels by removing excess moisture from the air, which can help prevent the growth of mold and mildew. Additionally, air conditioning units circulate and filter the air, trapping allergens and pollutants and improving indoor air quality. When using air conditioning, it's essential to properly maintain and clean the unit to ensure optimal performance and air quality. Regularly replace air filters according to the manufacturer's recommendations to prevent the buildup of dust, pollen, and other allergens. Clean air vents and ducts periodically to remove dust and debris that may accumulate over time. 5. Close windows and doors. Closing windows and doors during the rainy season is essential for individuals with asthma to minimize exposure to outdoor allergens and pollutants that can trigger asthma symptoms. Rainy weather can stir up allergens such as pollen, mold spores, and dust mites, making it important to create a barrier between indoor and outdoor environments to prevent their entry. During the rainy season, rainfall can cause airborne allergens to become more concentrated in the air, increasing the risk of exposure for individuals with asthma. Pollen grains can be dispersed by raindrops and carried into indoor spaces through open windows and doors, triggering allergic reactions and exacerbating asthma symptoms. Additionally, mold spores can be released into the air during rainy weather, posing a risk to individuals with mold allergies and asthma. Closing windows and doors helps create a seal between indoor and outdoor environments, reducing the entry of outdoor allergens and pollutants into indoor spaces. By keeping windows and doors closed, individuals can create a barrier that prevents allergens from entering their home and triggering asthma symptoms. 6. Dry clothes and shoes indoors. During the rainy season, it's essential to dry clothes and shoes indoors to prevent moisture buildup and reduce the risk of mold growth, which can exacerbate asthma symptoms. Wet clothes and shoes can introduce excess moisture into indoor spaces, creating an environment conducive to mold and mildew growth. When clothes or shoes are left to dry indoors, moisture from the fabric or material can evaporate into the air, increasing indoor humidity levels and creating conditions favorable for mold growth. Mold thrives in damp environments and can proliferate on wet clothing, shoes, or other fabrics if not dried properly. Exposure to mold spores can trigger allergic reactions and respiratory symptoms in individuals with asthma. To prevent mold growth and minimize the risk of asthma triggers, it's important to dry clothes and shoes indoors in a well-ventilated area with adequate air circulation. Hang damp clothes on a drying rack or clothesline in a well-ventilated room, preferably near a window or door to allow moisture to escape outdoors. Use a fan or dehumidifier to speed up the drying process and reduce indoor humidity levels. 7. Wear protective gear outdoors. During the rainy season, individuals with asthma should wear protective gear when venturing outdoors to minimize exposure to rain and damp conditions, which can exacerbate asthma symptoms. Protective gear such as raincoats, hats, and waterproof footwear can help keep individuals dry and reduce the risk of moisture-related asthma triggers. Raincoats and hats provide a barrier against rainwater, preventing individuals from getting wet and reducing the risk of moisture buildup on clothing and hair. Waterproof footwear helps keep feet dry and prevents moisture from seeping into shoes, reducing the risk of fungal infections and mold growth. By wearing protective gear, individuals can minimize exposure to rain and damp conditions, which can exacerbate asthma symptoms and trigger respiratory distress. 8. Take medications as prescribed. During the rainy season, individuals with asthma should ensure they take their prescribed asthma medications as directed by their healthcare provider. Consistent and timely use of asthma medications is essential for maintaining asthma control and preventing symptoms, especially during periods of increased asthma triggers such as rainy weather. Asthma medications are classified into two main categories: controller medications and rescue medications. Controller medications, such as inhaled corticosteroids and long-acting beta agonists, are taken regularly to prevent asthma symptoms and reduce airway inflammation. These medications help maintain long-term asthma control and should be used consistently, even when symptoms are not present. Rescue medications, such as short-acting beta agonists, are used as needed to relieve acute asthma symptoms and provide quick relief during asthma attacks or exacerbations. These medications work rapidly to relax the muscles around the airways and improve breathing, but they do not address the underlying inflammation associated with asthma. Individuals with asthma should have their rescue inhaler readily available at all times and use it as directed by their healthcare provider. 9. Avoid allergen exposure. During the rainy season, individuals with asthma should take steps to avoid exposure to common asthma triggers such as pollen, mold, dust mites, and outdoor pollutants. Rainy weather can exacerbate asthma symptoms by stirring up allergens and pollutants in the air, making it important to minimize exposure to these triggers to maintain asthma control. Pollen is a common outdoor allergen that can trigger asthma symptoms in sensitive individuals. During the rainy season, pollen grains can become airborne and travel long distances, posing a risk to individuals with asthma. To minimize exposure to pollen, individuals should avoid outdoor activities during periods of high pollen counts, typically on warm and windy days. Keeping windows and doors closed and using air conditioning can also help reduce indoor pollen levels. Mold spores are another common asthma trigger that can proliferate in damp and humid environments, such as during the rainy season. To minimize exposure to mold, individuals should keep indoor spaces clean and dry, promptly address any water leaks or plumbing issues, and use dehumidifiers to reduce indoor humidity levels. Avoiding outdoor activities in areas with visible mold growth, such as wooded areas or damp basements, can also help reduce exposure to mold spores. 10. Stay hydrated and maintain a healthy diet. During the rainy season, it's essential for individuals with asthma to stay hydrated and maintain a healthy diet to support overall respiratory health and immune function. Adequate hydration is important for keeping airway passages moist and preventing them from becoming dry and irritated, which can trigger asthma symptoms. Additionally, a balanced diet rich in fruits, vegetables, whole grains, and lean proteins provides essential nutrients that support immune function and respiratory health. Drinking plenty of water throughout the day helps keep airway passages moist and prevents them from becoming dry and irritated, which can exacerbate asthma symptoms. Dehydration can also lead to thickened mucus in the airways, making it harder to breathe and increasing the risk of asthma exacerbations. Therefore, individuals with asthma should aim to drink at least 8 glasses of water per day, or more if they are physically active or exposed to hot or humid conditions. 11. Practice breathing exercises and relaxation techniques. During the rainy season, individuals with asthma can benefit from practicing breathing exercises and relaxation techniques to manage stress and improve respiratory function. Stress and anxiety can exacerbate asthma symptoms by triggering the release of stress hormones and constricting airways, making it harder to breathe. Therefore, incorporating relaxation techniques into daily routines can help individuals with asthma manage their symptoms and promote better respiratory health. Deep breathing exercises, such as diaphragmatic breathing or belly breathing, help improve lung function and reduce the workload on the respiratory muscles. To practice diaphragmatic breathing, individuals should sit or lie down in a comfortable position, place one hand on their abdomen and the other hand on their chest, inhale deeply through their nose, allowing their abdomen to rise as they breathe in, and exhale slowly through their mouth, allowing their abdomen to fall as they breathe out. Repeat this process for several minutes to promote relaxation and reduce stress. 12. Consult your healthcare provider. During the rainy season, it's important for individuals with asthma to consult their healthcare provider for personalized advice and treatment adjustments. Healthcare providers can offer guidance on managing asthma symptoms during inclement weather and provide recommendations for optimizing asthma control. Individuals with asthma should schedule regular checkups with their healthcare provider to monitor their asthma control and adjust their treatment plan as needed. During these appointments, healthcare providers can assess asthma symptoms, review medication usage, and discuss any changes in asthma triggers or environmental factors that may affect asthma control during the rainy season. If asthma symptoms worsen or become difficult to manage during the rainy season, individuals should seek prompt medical attention from their healthcare provider. Healthcare providers can evaluate asthma symptoms, perform diagnostic tests if necessary, and adjust medication dosages or prescribe additional treatments to improve asthma control. In summary, individuals with asthma can take proactive steps to manage their symptoms and minimize the risk of exacerbations during the rainy season. By staying informed about weather forecasts, staying indoors during heavy rainfall, and implementing strategies to control indoor humidity and allergens, individuals can reduce exposure to asthma triggers and maintain better respiratory health. Additionally, taking medications as prescribed, practicing breathing exercises and relaxation techniques, and consulting with healthcare providers for personalized advice are essential components of effective asthma management during the rainy season. By incorporating these strategies into their daily routines, individuals with asthma can enjoy better asthma control and improved quality of life, even during inclement weather conditions.